Welcome, Vanessa, to the Nurse Wellness Podcast. I'm so
Thank
excited
you.
that you are here. I'm sorry, Dr. Vanessa Bolling. It's a pleasure to have you on the Nurse Wellness Podcast. I've been thinking about having you on for a while now. And this year kind of hit me that in order to have the discussion that I want to have today, you are the right person. So, how are you?
Awesome, awesome. I'm well. I'm well. Thank you for having me, Wendy. It's all about making sure that we stay in good health. So kudos to you. My hats go off to you as well. Thank you for having me.
Yes, more than welcome. Why don't we start by tell everyone a little bit about yourself. Who are you? What do you do? And how do we know each other?
Yes. Well, maybe I'll start off a little bit there. How we connected, how we got to know each other. Actually, I started my nursing career at the University of Connecticut, and in my undergraduate career, I was in your nursing lab, the simulations lab. So I remember vividly those labs. It was actually really great, and we definitely connected. And then we got to know each other a little bit more at St. Francis when we were working there on the floors. I think I was floating then, and you were on the oncology unit. Who am I? I'm Dr. Vanessa Bolling. I am a family nurse practitioner. I actually received my doctorate in nursing from the University of Connecticut this past May. And I've been in nursing for now over 12 years now. And I love the field of nursing. I'm very engaged. I'm actually in primary care right now in a family practice. Very engaged, very big on health promotion, preventative medicine, preventative care, behavioral lifestyle changes, all the above. I'm big on it. And I am the CEO and founder of Kingdom Health Connections. It's something that actually came, it was inspired by a leader of mine. And during the pandemic of COVID, when everybody's hearing about do this, do that, and everyone's in uproar, and Kingdom Health Connections came out. It was inspired by my leader, Apostle Suzanne Howard. And from there, what happened was I thought about it. I said, Kingdom Health Connections. When you think about a kingdom, every kingdom has a culture. Everything, who's from, you think about the United Kingdom, you can typically tell the culture by something, by what's happening, how the people dress, how the people respond, how they act. So why not have a culture of health and wellness for individuals who have chronic conditions or not? But Kingdom Health Connections is all about having a culture of health and wellness through generations. If you see my logo, you'll see the DNA strand as the tree trunk, and then you'll see some leaves coming out. It's all about the DNA of the thought, DNA of behavioral patterns for the individual, for families, for communities. And once we kind of deal with the root of things, we'll deal with the fruit of them. So that's when it affects the leaves and what happens in the person's physical bodies as a result of dealing with the DNA of the thought. So that's a little bit about me.
Ooh, that's a lot. I want to unpack all of that. I
Yes,
love it. So I will definitely put that in the show notes. People can like connect with you and see your beautiful
yes,
logo. And
yes.
that's exactly why I wanted you here. So this year I was thinking about, COVID-19 has been a thing for the past, I believe, 2 years now.
Mhm.
And, we've been crippled by it, even paralyzed, like I like to say, because it really shifted us, professionally, personally.
Absolutely.
But I was doing some research because I write for the Color of Wellness magazine. And, I was doing some research and, I just was looking at mortality rates and, cancer and heart disease are still up there. So it's cancer, heart disease,
Very
COVID-19. And I think, many people are losing focus of health and wellness outside of COVID. So last year I was, really doing a PSA for get your mammograms, get your colonoscopies, go to your well visits. And I know many people stopped going to the doctor because of COVID. A lot of people are not up to date on their screenings. So I wanted to do this episode to really get out there the importance of health and wellness outside of COVID. So, what we need to do on a routine basis to stay healthy. And Vanessa, you are the one to come here and really kind of talk to us and engage in the conversation about that. So, can you tell our listeners a little bit about what you do on your platform?
Yes, absolutely. So on the Kingdom Health Connections live platform, typically I'm talking about health and wellness tips, practical health and wellness tips that individuals, myself, we can all do. I do every year it was a different focus. This year I'm kind of focusing more on the ABCs of health, the simplicity of health, because a lot of the times when people think about health and wellness, they think about this to-do list that's overwhelming. Oh my God, I can't be healthy. I can't do this thing. I can't do this. I just live my life, and until something hurts, then I'll come see about you. But just kind of dealing with the ABCs of health. How do we boost our immune systems? But last year, I really took on the health promotional role of looking at of the year, what's for January, what's for February. We know it's National Heart Awareness Month, and promoting that. So talking about the common chronic health conditions that we see in the month, and talking about it, like, here's the condition, here's the disease patterns, here's what's to look out for it. When do we need to go to our providers about it, whether it's a physician, an NP, or a specialist? And then these are ways in which we can prevent it. These are ways in which we can probably even reverse it, because there's a lot of research that shows that a lot of chronic conditions are actually caused as a result of behavioral patterns. So a lot of them, more than 40% was the latest information that's out there. More than 40% of chronic conditions can be prevented. And it's from the behavioral patterns. But all behaviors start with a thought. And, before it gets into a habit, and gets into our chemistry, which sometimes we're actually battling our chemistry, but it all starts with a thought, what we've been taught, and then we continue in those patterns. So,
Yeah, you bring up a really good point. So, everyone knows I focus on stress management.
yes.
Stress is a precursor to a lot of chronic illness that people just they're not aware of, because we normalize stress. And that's why I'm on the mission to really help people manage their stress, because we're all capable. Many, chronic diseases associated with chronic stress. And in America, we are one of the top countries with the most stressful individuals, right?
I
So
believe it. I wonder.
yeah, so stress management is a behavior change, but I think you bring up a really good point about culture, right? So how you were raised, even in terms of, did your family go to the doctor, right? So I know, even for me personally, my mother was not a person that went to the doctor, right? It was like not her thing. And here I am, I'm a nurse practitioner, right? So I'm all about health and wellness. Now she's at the doctor, but she's older, and of course she has some chronic illnesses. So I wonder, if she went before, was proactive, would she still have, these chronic conditions? But I say that to say that everyone can be a change agent.
Absolutely.
It doesn't matter your history, how you were raised, what your thoughts were back then. You know the right thing to do, so you can be the change agent and start the discussion with your family, with your kids, and really change the trajectory of health for you and your family.
Absolutely.
You also said something else that kind of pertains to DNA, your logo.
Yes.
I think it's important, and a lot of people don't think of this, and especially for me, I'm in the oncology space, is to know your history. What is your family history? What are you predisposed to? Right. So I think that is so important. Can you speak on that? How do you coach or counsel your patients in terms of history and being proactive in behavior change?
Absolutely. So of course, when I see anyone in, say, I use my office as an example. When I see anyone in the office, that's like the bread and butter, what we start off with. That question, who are you? What's your family history? What's your upbringing patterns? And based off of that history, it's like, together, me and I like to use client more than patient, but we'll use patient because we know that word. But me and the patient and I, the individual and I, we see what's going on, and we look at their demographics, and we look at their height, their weight, their blood pressure, and look at the lab work. Of course, we have that objective information too as well. And together, they may be in a healthy state, so healthy being without disease. They may be in a healthy state, but based off of, say, their weight, I tend to always key into that. When you come into my exam rooms, I have some information, some pictures, some visual stimulating pictures about what our plate should look like. And that typically is a conversation that's easy to have in my office setting just because of that. But based off of the family history, how should we be living? It's not a matter of living, oh my God, I want to prevent having a cabbage. Oh my God, I want to prevent having a myocardial infarction. Oh my God, I want to prevent this. It's not living in fear. It's like what you said, is being the change agent, realizing I have control. I've got the power over my own life to make something that's a hashtag with Kingdom Health Connections as well. I can actually choose life and by what I eat, what I drink, how much I sleep, what things I engage in. Am I controlling my stress? Am I out exercising? Am I exercising in my home? Really kind of just creating this picture and this plan that's customized. It's a personalized healthcare system, a way of living just for the individual. And the goal is that they train their children as well. And because I see family units, I see moms, dad, grandparents, great grands. I have a family, actually 4 generations. I see it's beautiful. So it's really beautiful to be able to tie everything together, and be able to communicate through the different generations, and they kind of move in the right direction, not in fear, but in empowering them essentially to make the right decisions, and letting them kind of like uncover the ways in which it's doable for them, because I can come up with a plan all day long, but it's seeing, okay, what are you able to do? What's feasible for you? I might say, yeah, go to the gym and exercise 5 times a week, but the gym may not be your setting. Perhaps you like outdoors. So let's find out what's feasible for you as an individual. Let's uncover that. Let's unpack that. And let's, more than likely, if that's what you enjoy doing, you're going to stick with it. And that's what I would encourage you on. And a lot of the times, through that family history, through that unpacking, a lot of the times when individuals come back to their appointments, that's the first thing they're, Dr. Vanessa, I quit smoking. Dr. Vanessa, I lost 10 pounds. And I asked them, how do you feel about it? And they're on it. They realize that they are the change agent, and they don't have to live in fear based off of their family history.
Yeah, absolutely. And I think you bring up a good thing about accountability. So the
Yes.
patients are they're so prideful when they come back and they have accomplished
Yes.
their goal, to tell you they're so excited, you're high-fiving them, which is something I just love about, what we do as nurses.
Yes.
And I want to pivot a little bit, because that's why, for me, I became a life coach.
Mm.
A life coach in terms of, helping people manage their stress, because we have an impact, and I'm going to get on impact. That's my word.
Yeah.
We impact patients in the healthcare system, but we can also have impact outside, right? And that's why we're here today speaking on this podcast. This is an external impact that we are having on the world. And what I tell people is that it's really hard to change your behavior, and there are 6 different steps in behavior change. But you need something that motivates you. And I use purpose
Yeah.
and impact. So what is your purpose and impact? And that is your why. That should be your motivator to propel you forward to want to make the change. But it's still hard, because many people haven't been sick or bedbound. And I just want to tell a personal story of how I started the year off. So I started this year off, and many people probably heard the story already, but I had all these plans, right? I was going to walk in my purpose and continue to have impact. And that was, I believe, Friday before the new year. And then Sunday, I became ill. And I remember being like bedbound ill, like fatigue. I could not do anything.
Wow.
And
I
that
know. Yeah.
made me think of the whole, not really self-care, but health care. Health
Yeah.
care, taking
Yes.
care of your health, exactly what we're talking about now. And that
Yeah.
self-care is really the foundation, right?
Yeah.
Self-care means different things to different people, but I think it's hard to hear if you've never been there. But believe me, you don't want to be there, because Vanessa and I, we've seen it.
Yes.
We've seen people on the unit, right? We've seen people in the office. We've seen them in different stages. But health promotion is so important, so important.
Absolutely.
So, Vanessa, and I love that you kind of alluded to this, but I want you to tell people about your project, your end of year project for your doctorate. I had the honor of sitting in and
Yeah.
watching
That's
Vanessa
right.
present this beautiful presentation, and I would
Yeah.
love for her to just tell us a little bit about it.
Yeah, absolutely. So it's kind of it stemmed from just being in practice, and I'm a problem solver. I believe most of the times, nurse practitioners, we're the solutionists. We like working towards the solution. I don't really enjoy kind of being redundant and nothing's being fixed or nothing's getting better. So I realized that my interest a lot of the time it is on weight management. Obesity is the other term. And I realized that obesity it's termed as a neurobehavioral chronic disease, but it's the root. Remember that DNA strand? It's kind of like the root that deals with a lot of chronic conditions. And it's literally the elephant in the room that none of us really know. We've not been trained words, different things of that sort on how to actually address it with the patient or the individual or families that we're dealing. Maybe we're dealing with the child and we have to address mom and dad. How do we do this? We don't want the child to feel less than or feel stigmatized in the office, and then they go out and deal with other kids. So this huge concept of how do we as primary care providers actually talk about health weight management in the office. So from that, I really developed a program called Back to Basics. I developed an obesity training program for primary care providers. It's called Back to the Basics. People wouldn't be interested in it per se because I know how to talk to somebody about their weight, but it's all about the language. It's all about unpacking, um, uncovering what's the root cause of this thing that we're dealing with. Is it unaddressed stress? Is it unaddressed trauma? Is it, emotional eating has to stem back to something. You know what I mean? And how do we address it? Because this is the huge elephant in the room, as we would say. This is a huge concern that's dealing to all your hypertension, your hyperlipidemia, your type 2 diabetes, your GERD, your asthma is worse. Sleep apnea is present as a result. How do we address this root chronic disease and or this chronic condition and start to do the reversal process, because it can happen. So essentially I created a program called Back, focusing on the language of what primary care providers should use or even specialists can use. I dealt with primary care providers, physicians, NPs, and PAs within the first 1 to 2 years of hire. And with that program, I was able to essentially see that with the training, their confidence actually increased after the program. I did a pre and post assessment, and their confidence increased after the program. Not only that, I was also measuring to see if the referral patterns had changed. So were they referring more to the nutritionist? Were they referring more to the weight management specialist? Were they referring more to bariatric surgery? And we found that they did. And it was interesting to find that not only did the referral patterns increase to these specialists, but more were sent to the nutritionist. So it's cool to see where people are more inclined to lean toward the basics, back to the basics, right? Nutrition. And the second level of interest was weight management, where of course it's nutrition, behavioral change, but there's pharmacology involved too as well. And then bariatric surgery as well. So it helps to kind of stratify and see exactly where people's interests are. Not only that, a lot of the times it's, patients would say that I don't want to do surgery. I don't want to do surgery, but it's being able to appropriately now refer individuals that really do need surgery versus nutrition. Everything serves its appropriate purpose, but it's making sure we're getting individuals in the right place at the right time.
Yes, I think that is
For to meet.
amazing. Yeah, such an amazing program. And one thing I was
Yes.
thinking about is cultural competence too, right? Because you have to explore that depending on
Yeah.
who you're working with. And one thing I do want you to speak on is, being in primary care, we know you don't have a lot of time
Mm.
with patients.
Yeah.
So how do you mitigate that? Someone listening and, they're saying they go to their doctor, they're kind of in and out. Can you talk a little bit about advocacy, the advocacy piece there?
So, yes, absolutely. Times we don't have as much time in the area of talking about weight management with individuals in that time frame. It can happen within 5 minutes. It is doable, and it's not a complete work that happens in that time frame. It's just step by step. Oh yeah, how are we doing exercise today? Starting there. How do you feel about your weight? Starting there. That's a nice way to introduce, talking about someone's weight. They'll start talking about it from there, and we start problem solving from there. But how I tend to advocate is I advocate with the front staff. I talk with my management. I vouch and I say, listen, I need more time. I need more time. I get to know the individuals that I work with and families I work with as well. I know who may need 30 minutes versus 45 minutes. And I push for it. And it's not always perfect. And that's a bit frustrating because it kind of goes against my nature of really spending that time working with and unpacking what we need to unpack. But I really do make sure I consistent that I work with. We look over my schedule for the week. And based off of what we even talked about the last time, again, it's a continual process. It's not just a one and done process, but we continue the discussion of it. And that's the realistic way of addressing it. It's not trying to address weight management per se in just this one setting. No, it took a while to pack on. We got to take the time to pack it off too as well. So really communicating with my medical assistant staff, the front desk staff, as well as management to ensure that I get the time that I need.
Yeah, no, that's awesome. That's awesome. So I want to say two things. One is I know we have a lot of nurses and healthcare leaders who listen to the podcast. And what I want to say to you is you have the ability to be the change agent outside of the hospital. I think many times, we think about ourselves just in a healthcare setting, but this is such a great time and opportunity for us to stand in the gap for society.
Yeah,
Like
absolutely.
Vanessa, you are a prime example of that. You are doing things outside for the community. They're hearing
Yes.
from a specialist, right?
Yes.
And like I started this podcast, cancer and heart disease are still the two highest
Yeah.
killers in the United States. So we can still be out there talking to family members, talking to people. This pandemic has opened up such opportunity for especially healthcare providers, especially, social media. I know people don't like social media, but it is a way for us to get our message out to the world. While you're
Absolutely.
sleeping, people are listening to your message. That's powerful. That's impact. And if we all
Yeah.
did that, if we all just did a little bit of that, we can change the way people are changing people's health pattern. I'm so excited, I don't know what to say, but we can
Yeah.
be I'm just so like it's just such an amazing thing. And I
Yes.
think just it's opportunity, even though it's crisis, COVID, yes, people are dying.
Yeah.
There's a lot going on in the hospital with healthcare providers, but we have our own platform. That's what social media is. It's really our platform, and it's how we use it to talk to the people. Think
Absolutely.
about why you went into nursing.
Yeah.
Why did you go into nursing? Take that and try to do something outside of the hospital. Like
Yeah.
in the community, on social media. If you don't know where to start, but you want to do something, reach out to myself or Vanessa.
Yes.
We can definitely collaborate, because
Yes.
I don't know, this year I just feel so passionate about it because of just my experience.
Yes.
And the
Mine
reason
too.
I'm saying that is because I believe everyone has a purpose. Everyone has the ability to impact this world.
Absolutely.
And I'm pushing for that. And because I just truly, truly believe that.
Yeah,
So,
absolutely.
and the individuals who are not healthcare professionals who listen to the podcast, please, 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 please make sure you go for your wellness visits,
Yes.
your screenings, your colonoscopies, your mammograms. Vanessa, help me. Your A1C screening, your
Yes.
CBCs.
Cholesterol screenings, your eye screenings, even your dental screenings, everything is connected.
Yes, yeah, and please just ensure that you are taking care of yourself,
Yeah,
because all that stuff catches up with you.
it does.
It catches up with you. It doesn't matter how young you are or how old you are. And if you're older and listening to this, make sure you are taking your medication. If you're having any side effects from medication, please talk to your provider. Just don't stop it on your own.
Yeah.
Be in communication with your team.
Yeah.
If you feel like you can't, reach out. If you need an advocate, reach out to Vanessa, reach out to myself. We are here to help you. So I just feel so passionate about it. Vanessa, do you have any
Absolutely.
parting words before we do our rapid fire, before we end the podcast episode?
I would say, for as a provider, I said it at the beginning of 2022, actually 2021 into 2022. I too have also had some experience with the healthcare system at the beginning. Let's say 2022 came in with a bang, and it's affecting providers as much as it is the patients and families that we see. But the biggest thing, we have to make our health, and we're seeing this all through the pandemic, we have to make our health a priority. Our spiritual health, physical health, mental health, a priority, not to our patients and families we care for, but we also have to do it for ourselves. And make your health a priority.
Especially mental health. I'm sorry.
Please.
Mental health, with everything that's going on in healthcare, especially the nursing shortage crisis. We know mental health is a thing, and it's not something that we normalize. We need to normalize talking about it.
Yes.
So if you are having issues, please reach out to your provider. If you need an advocate, please reach out to Vanessa or myself. We will walk with you through that.
Yes.
But don't feel like you're alone. You are not alone. It doesn't matter what you're going through. You are not alone. So, Vanessa, it was a pleasure having you. Can you let people know how to get in contact with you?
Absolutely. Absolutely. You can actually find me on the Kingdom Health Connections page. If you're on Facebook or Instagram, Kingdom Health Connections, you should be able to find me there. And I also have a personal page for Vanessa Bolling as well.
Awesome. So let me take you through a rapid fire. We will definitely have to have you back again a couple of times this year, because I want to continue this conversation. So Vanessa, we're going to take you through a rapid fire. Let me know the first answer or thing that comes to your mind after I ask you the question or statement. So wellness means?
Wholeness.
I know I'm stressed when?
Start perspiring.
My go-to stress management solution is?
I definitely go. Uh-oh, it froze.
Oh, yep. Say that again.
I said I go outside and I definitely pray. Going outdoors and praying.
Awesome. The last time I had a belly laugh was?
2 days ago.
Can you tell us more?
I honestly was laughing at myself. Laughing at myself, which is a good laugh.
Yes. Awesome. The one thing I learned about myself during the COVID-19 pandemic is?
I am important.
And do you have a word for the year? I know people are doing words opposed to resolutions. Do you have a word or a saying or a quote that gets you going and motivates you and refocuses you on what you need to do?
I would say what I said earlier, that my health is a priority.
Nice. Awesome. Well, thank you so much, Vanessa, for being here with us. It has been a pleasure, and we will have you back.
All righty. Thank you so much, Wendy.